40 to 49 years of age, 24 positive cases. 50 to 59 years, 25 positive cases. 60 to 69, 34 positive cases. 70 to 79, 11 positive cases. 80 to 89 years of age, 4. And 90 and above, 1. That's a total of 133. In regards to the gender, majority, 71 of them are females, and 62 are male. In regards to the medical status, we have 58 that are stable, 12 are hospitalized, 5 at the inpatient care at GMH, 1 at the ICU at GMH, and 6 at the SNU at GMH. We have 58 that have recovered, 16 more as of today, to yesterday. That's 5, and the grand total is 133. Now, the locations of all these cases, we have 40 right now in home isolation. 18 are in the Government of Guam isolation facilities, 6 are at SNU, 5 are at the inpatient care unit at GMH, 1 is at the ICU at GMH, and as I mentioned earlier, 58 have recovered, 5 have died. In regards to the travel history, of the 18 that have traveled, 3 traveled to multiple countries, with 65% traveling to the Philippines. 115, however, have no travel history at all. And the breakdown of those without travel history are as follows. 32 have a household contacts, 12 community contacts, 19 have a healthcare contact, and that is further broken down into 5 as a patient, 14 as a healthcare worker, and 52 have no reported contact at all. There currently are 174 individuals in our quarantine sites. In addition to that, we do have individuals, approximately right now, 233 that have cleared their whole 14 days of quarantine. And of course, as I mentioned earlier, 18 remain in our isolated Government of Guam facility. In regards to those that have recovered, 58. The age breakdown are as follows. 0 to 9 years old, none. 10 to 19 years of age, 3. 20 to 29 years of age, 7. 30 to 39, 9. 40 to 49 years of age, 13. 50 to 59 years of age, 7. 60 to 69 years of age, 11. 70 to 79 years of age, 4. 80 to 89 years of age, 3. 90 and above, 1. In regards to those who have recovered, their sex, 31 are female, 27 male. The distribution as far as all those that have recovered, 20 reside in the northern, 27 at central region of the island, and 11 at the southern region. Those that have traveled in the first 14 days, 11, no history, 30, undetermined, 17 at this point in time. Thank you.
Thank you, Linda. We're open for questions now.
This is a reminder to all our reporters today to get 1 question and 1 follow-up. We'll begin with Guam Daily Post, John O'Connor. Your question?
Hello, Governor. Can you hear me?
Yes.
Okay. We've gotten the updates from public health regarding the clusters of COVID-19 cases, but we don't have the names of certain facilities or other specific information. Doesn't withholding this information hinder more than help in terms of finding more people who could be COVID infected, since they may not know exactly which facilities had COVID positive cases?
No, it does not hinder public health because they have the information and they do the contact tracing and they do the surveillance.
What if members of the public aren't asked or don't know where these places are? They may not be able to contact public health and say, hey, I visited this place, because they don't have that information out there.
So, John, it goes back again to stay home, if you're starting to have symptoms of any kind, contact your physician so that they can then do whatever treatment or course of action that is appropriate. The fact that they don't know where these doesn't really impact what needs to be done in terms of treatment and in terms of measures. So public health has the information, they know where it's at, they do contact tracing, they've identified people, and so forth. So they are in control and they are doing everything within the guidelines and standards, and they're actually identifying people as quickly as possible.
Thank you, John. Next is Pacific Island Time. Johanna, your question.
Half a day. So this question is for Minoni.
Okay.
Good afternoon, Joanna.
Half a day, sir. So I'm wondering, how did the sailors celebrate Easter? Did the chaplain have a special prayer for them or anything, like any special dinner?
So, great question. I really can't answer that in terms of how the sailors celebrated Easter on the ship. I will tell you that the sailors in the hotels are confined to their rooms, so there's no group gatherings, no real ability to celebrate Easter in terms of like a public mass or anything like that. And I can only truthfully speak for my own experience, which was sitting at home by myself with my baby dog.
Your next question, Joanna.
That is all.
Thank you, Joanna. Next is I-94, Adriana.
Hi, can you hear me?
Yes.
Am I allowed her question that she didn't present?
Start with her question. Go ahead, Adriana.
All right, so my first question is, so we've learned to date that there are 585 infected from the U.S. Theodore Roosevelt, and I know that previously the governor had mentioned that there's an agreement with Admiral Minoni to provide additional healthcare personnel once they complete their primary operation. But since the number of confirmed cases and the numbers have climbed to an extremely high count right now, then that support to our healthcare workforce likely won't be an immediate response for our potential surge. So is there a more immediate or alternative plan in the works?
So, a great question. You know, there's 585 crew that's reported as positives today, and that's of a significant amount of sailors. And you can go and Google how many sailors are typically on aircraft carriers. So I wouldn't call it an extreme amount. Currently we have medical providers that are providing 2 times a checks per day for sailors, both in hotels as well as on Naval Base Guam, as well as we built out some facilities on Naval Base Guam that are able to house a significant amount of sailors so that they could have, if they're in a sort of a quarantine or isolation phase, we can have medical folks constantly monitoring them, in addition to the folks that would potentially be sent to the Naval Hospital for treatment. We are also bringing additional capabilities to this island. Those capabilities aren't built yet, but that will bring with them additional medical providers as well as support personnel that'll be placed. And the governor and I will announce those facilities at a later date, but they are in work as we speak.
Right.
I hope that answers your question.
Well, not so much, because my question's more so when we'll have that additional healthcare service here. So I know that you guys are focusing in on your primary mission, but as far as getting it here, you said in a couple of weeks.
So, you know, there are a couple lines of effort that are working. My primary mission right now is to help TR sailors get healthy again and get that ship to sea. In conjunction, at the same time as I'm doing that, I'm worrying about building that extra capacity should the governor request defense support of civilian authorities. If that's requested, my intention is to be prepared to answer that bell when it comes. So we're working on that right now. If I gave you a timeline, I'd probably be wrong at this point, because there's a lot of variables that go into building those types of facilities and that type of capacity and capability.
Okay, so as of right now, that bell has not been rung.
No, I don't have a request at this time.
Thank you, Adriana. Next is PNC Kevin Kerrigan.
Good afternoon, Governor.
Good afternoon, Kevin.
I wanted to ask you about your Facebook posting this morning. It was relatively optimistic, I thought. You spoke about the 17 reported recoveries over the weekend. You said we're seeing our recoveries faster than our infection rate and a recovery rate of 44%. My question is, does this mean we have begun to flatten the curve?
What it means is that we haven't yet seen the surge. And the way it is now is where I would like it to be. And as I said, I would prefer if at this point in time we would have 100% recovery. This does not mean, Kevin, in any way that we let our guards down, because we must continue to work as hard, as seriously, and as best we can, so that we can continue on this low trajectory that we are seeing. I think once we let our guard down, you can bet that we will be seeing much more infection rates and much more positive COVID cases. So the fact that we have instituted these measures early on, as we can possibly have predicted, we did it very early on. We did aggressive measures very early on. We stayed the course. You know, we were out there pleading with the community to stay home. It was a little bit slow in staying home, but I think we are getting to where we are only traveling for essential businesses and essential activities. So I am only reporting what I am seeing in terms of numbers. And for me, it is, like I said, a light at the end of the tunnel, but it isn't a go and lift restrictions right now, because the worst thing that could happen is that if restrictions are lifted and then we start reinfecting again, we would have to rebuild everything that we have done so far in terms of barriers and slowing the spread. What we actually have done is slow the spread down, and we must continue on that course.
My second question, Governor, has to do with the road closures over the weekend. I'm sure that you're familiar with the complaints from the public. We've heard them here as well. They seem to be effective in terms of limiting travel, at least for some people. I'm wondering if you could help us better understand why you need even more enforcement powers to implement checkpoints and curfews. Aren't the road closures enough?
So my request for enforcement power is just so that I can at least tie something to a penalty if you're not following the mandates, or if you're not adhering to the curfews. By the way, has not been passed, nor has my enforcement request been passed. But the enforcement, Kevin, just gives it much more teeth, I think, to people, because they might say, oh, so I didn't really follow the governor's law, so what, right? I'm not penalized. I don't have consequences as a result of this. So what the enforcement power does, it just strengthens the mandate to stay home. And I gave the example of how people don't really follow speed limits. And when they do the speed traps, everybody the next day is going to follow the speed limit. But once the speed traps are there, they don't follow anymore. So that's just, I don't know, human behavior or human reaction. But this is a very serious situation. And I want to make sure that it's really impressed on our people's minds, and so that they can change their behavior. And like I said, travel only for essential business.
Thank you, Kevin. Next is CDN, Jared 1.
Hi, Governor.
Hi, Jared.
I wanted to ask where we are on testing. How many test kits do we have, and are you planning on doing more tests if there are more testing here?
Yeah, so I have Linda report that because there is some more capacity that we're looking at, but she has the most up-to-date information.
Thank you.
Yes, we have the, as you know, the ADI 7500 that we're using right now. We have about 315 test kits left, and so that will test about 315 samples of the nasopharyngeal swabs. We're also expecting, I'm hoping that it will be in this flight today from FEMA, 2 additional tests, which is the Abbott new now kit and also the machines. We have 2 machines that are arriving and also 200 cartridges. In addition to that, we also are expecting a gene expert machine. We already have it actually in our lab, but what we're expecting is the actual test kits. We have about 460 tests, and each of those tests has about 10, so that's an additional 4,600 test kits that will be arriving. And that's again from a special grant through the Pacific Island Health Officers Association. In line with that, we're going to continue our efforts with our commercial testing, which is currently being done by the Diagnostic Laboratory Services, and all those tests are all going out, and that will continue through our contractual agreement. So far, we have about 89 tests that have already gone out, and we are going to continue. And in fact, we're working more to expedite more testing as we speak.
And my next question is for Admiral Manoni.
Okay.
Go ahead.
Admiral, so we heard that one of the sailors left one of the hotel sites to go back to base because he complained that his internet service was down. I don't know if that's true or not, so we asked.
So that's an erroneous report.
Okay.
The best I can tell you, we're investigating. There was a break of a quarantine in one of the hotels. That sailor, as I committed to the governor and the community of Guam, that sailor was pulled then from the hotel. It was all internal to the hotel. That sailor was pulled from the hotel, taken back to Naval Base Guam with all the evidence from the investigation that ensued and turned over to the command for further investigation and then any possible consequences from that.
Thank you, Jared. Next is Station 7, Navy.
Hi, this question is actually for the Admiral.
Okay.
Sorry, Governor.
I'm going to stay up here. Good afternoon.
Hi, Admiral. I'm just wondering if any of the sailors who initially tested negative and then were put into the hotels down in Tuman have since exhibited any symptoms. So,
again, with the process that we've set up, we do dual medical checks. So, in-person medical check, we do a on-the-phone medical check, and then sailors have an app on their phones where they do a kind of a virtual medical check during the day. And any sailors that display any symptoms, whether they're COVID-19 related or something else, immediately are evaluated on site by a medical provider. If necessary, those sailors are then transported to Naval Hospital for further evaluation. If there's any suspicion of COVID-19, those sailors are then either treated at Naval Hospital and held there, or they're put back in isolation back on Naval Base Guam.
Your next question, Dave?
Okay, so a follow-up from that will be, have any of the sailors that were put into the hotels as negative initially, have they tested positive? Have any that were in the hotels now tested positive?
You know, I'm not going to get into positives or negatives because we could go down a road that go round and around about the data. And I don't have that in front of me, so I cannot really answer that question accurately. I'll just tell you again, anybody who said that's any symptoms is immediately evaluated, immediately pulled out of the hotel, immediately gotten to Naval Hospital Guam, and then if there's a suspicion, even a suspicion, not a test, a suspicion of COVID-19, they're taken back to Naval Base Guam and put in isolation with medical care on Naval Base Guam.
Thank you, May. Next is Mariana Zimmerberg. Morning, Mark.
So I have one question for the Gov and then one for the Admiral. Buenas, Governor.
Buenas, Maureen.
So, assuming that you're going to ask that these road checks continue, is it possible to do them in a more orderly fashion so that commercial vehicles going to and from the port are perhaps given their own lane and people can join that if they have a legitimate reason or a pass of some kind from an employer?
Yes. So the roadblocks are going to continue, and commercial vehicles and other essential people will be waived on, and I think they will have a separate lane for them. That's already been decided, and it should be happening now.
Okay, thank you, ma'am. I have one question for the Admiral.
Good afternoon.
Good afternoon, Admiral. There's two parts to this one question. So firstly, could you let me know if there are positive cases among the Air Force population? And secondly, I wanted to just ask what will happen to all the sailors of the Theodore Roosevelt in the timeline that exists?
Okay, so with respect to the military on Guam, we're not going to talk about specifics to each service because then I would be giving you specifics on cases on actual installations and bases, and that's just not the way we do business. However, there are cases, if I may, there are cases that are in the local DoD military here. I believe the total number of active duty cases was 2, and I believe both those cases are getting ready to clear their quarantine. But with respect to each base or each individual unit, I'm not going to talk about that. To the second part of your question, with respect to the sailors that are in quarantine or in isolation or on working on the ship, working through the cleaning process, as we out-test people from their quarantine or isolate personnel that are in isolation, show no symptoms, and then receive a negative out-test, those sailors will likely flow back to the ship. Once that ship is clean and safe, once they're on the ship, they'll take it to sea when the time is right. If there's anybody who still displays symptoms or requires medical care, they'll be held within the fence lines of Naval Base Guam and Naval Hospital and treated appropriately. Anybody that would need some sort of higher level of care will have to work through that with the medical professionals.
So just a clarification, my question about...
Thanks, Maureen. Those were your questions. Next, we have PUAM, Nestor and Ponto.
Good afternoon. First questions for the Governor.
Yes, hi, Nestor.
Hi, Governor. The legislature, and I believe the bill is on the voting file now, one of the provisions is to give you authorization to hire temporary employees as needed or redirect existing employees to help expedite programs related to the CARES Act. And as Department of Labor Director David De La Sola has said, there might be up to 38,000 applicants for unemployment. What do you think of that provision? Is that necessary for you?
I don't think that provision is necessary. That's already within my executive authority and my executive powers. And we are already doing that. We are already redirecting resources to Dave De La Sola And we have approved that if he needs to hire more people, that he has been given the approval to do so. So we don't really need legislation. The legislation that I need, Nestor, is the legislation to allow me to enforce my mandates and enforce my executive order, and also the legislation to allow to extend the curfews to all residents of Guam.
All right, thank you, Governor. And the second question is for the Admiral.
Good afternoon, Nestor.
Good afternoon, Admiral. Good to see you.
Good to see you too.
So there are over 3,700 who have tested negative. Where are these sailors? Are they in Tumon?
So there's a combination of them that are in Tumon. There's a combination that we held back on Naval Base Guam. Since they started their isolation on Naval Base Guam, or quarantine on Naval Base Guam, it seemed, and we had the capacity to hold them there, it seemed better just to keep them within the confines of the base so we wouldn't break their quarantine. We'll test those folks again before they get back on the ship once the ship is certified clean.
Thank you, Nestor. Next is the point, Nick Delgado.
I apologize here. This question is for Rear Admiral Noni. If he can provide us the status of those 585 positive cases, as well as the number of those hospitalized sailors since the 2 that were reported last week.
So, Nick, we can't talk about any sort of HIPAA information. I'll tell you that the sailors that are either at the hospital or that have tested positive that are in isolation are being cared for by medical professionals. They're checked multiple times a day. If they need higher levels of medical care, they get it. If they're asymptomatic but positive, we're monitoring them very closely for any development of symptoms. But they're getting very good, very focused medical care at this time.
Okay, but you can't say more, you said, because of HIPAA to those 2
I'm going to respect their privacy and the privacy that their families demand, and I'm not going to talk about their specific medical conditions.
No worries, sir. All the best to you and the sailors. This next question is for the governor. Hi, Gov.
Hi, Nick.
Okay, so day 3 of the roadblocks. So the effort was to keep people off the roads. You impose those roadblocks, or what seems to be an educational campaign. And you've also told the people that have been laid off to go out and apply for food stamps and other essential public assistance that they need. Yet in order for them to do that, they would need to go out on the road to obtain those necessary documents, submit them even to be considered. So how do you feel that these closures are helping those people who are trying to apply for those assistance? They're running out of money to buy food, much less the gas, and are now have to wait in these checkpoints, these roadblocks, so they can get the assistance that they need.
Right. So my understanding is they can do it online also. But Linda can talk more about that. But if they do have to be on the road traveling for essential business, then absolutely, they need to do that. Anyway, here's Linda.
Yes, I've already instructed all my staff that we're going to make it a lot easier so that we don't have any crowding at any of our sites at the public health facilities. And so how are we going to do that? We're asking them, we're calling them, everything is done by phone. If they need to drop off any documents, we're not going to have them come into any of these facilities. You need to drop off anything or just send it electronically. If that doesn't work, you can just mail it out. That's a lot easier. And we work with all the mayors so that if they need a mayor's verification, all they have to do is we list all of the names of these individuals that need mayor's verification. We send that listing to the mayors. Mayors will respond back and give us a verification. That's moving a lot of things so that we don't even have to worry about them going even to the mayor's office. Everything will be done that way, and we're going to continue it that way so that we don't have them at any of our facilities. Everything is done electronically or via mail. Thank you.
Thank you, Nick. Announcements and closing remarks.
Thank you, Janella. Today's COVID hero is Ms. Young S. Koo with Momo Corporation and 7 Day Supermarket. She made a generous donation of snacks and water to the Emergency Operations Center. In addition, she donated 10,000 face masks to our healthcare workers. This donation is being distributed based on healthcare priorities. She is continuously working with the Emergency Operations Center in any way she can. I want to personally thank, and on behalf of the people of Guam and our healthcare workers, Mrs. Koo, thank you for being a COVID hero. And remember, stay home. Thank you, Mrs. Mock.